Welcome back to Fox 11, everybody. Summer is here, and taking care of your skin this season can be a challenge. And dermatologist Dr. Ann Truitt joining us this morning. She has some tips to make sure that our summer skincare routine is safe and effective. Good morning, Dr. Truitt. How are you?
Good morning. Thank you for having me.
Of course. Always good to talk to you. All right, let's find out what we can know about taking care of our skin this summer. Obviously, we think sunscreen right away, but what are some of the concerns? We've seen these studies out there about benzene, right?
Yes. So there was an independent study that was done by an independent laboratory named Valisure, and they looked at 294 different sunscreens as well as after sun care products. And they found that 78 of these products had the chemical compound benzene. Now, it is important to note that this study has not been peer reviewed in the literature, and that benzene is a carcinogen. It has been related to forming cancer, specifically blood cancers like leukemia. Now, it is important to note that benzene is not an ingredient in sunscreen. It is not a breakdown component of sunscreen. So that led scientists to believe that it was most likely a contaminant within the process of making the sunscreens. But then dermatologists and scientists started looking at the actual study and had some serious questions about the methodology of this study. They looked at the oral exposure of benzene, which sunscreen is topical. They also looked at a product called NDMA and used that as a comparison instead of benzene, which these two chemicals are very different and have different characteristics to it. So that kind of led scientists to make the comment that this is really kind of a nonsensical comparison. But it's also important to note that benzene is in many different products. It's the building block of aspirin. It's also found in burning of wood and fossil fuels. So they kind of made the comparison of the absolute worst scenario, that a full body application of sunscreen might be comparable to the exposure of maybe half of a day that what you would breathe in of benzene during the day in the city. So the bottom line is that really the study, the jury is still out on this study, and that there's a lot more research that needs to be done. But what we do know is that skin cancer is the #1 cancer in the United States, that it occurs more frequently than all of the other cancers combined, and that it is related to UV exposure. And in fact, 86% of melanomas, which are the more deadly skin cancers, are related to UV exposure. And the best way to combat that UV exposure from the sun is by using sunscreen. So we do not want the public to stop using sunscreen based upon this study.
What kind of sunscreens do you suggest for people that are obviously going to be heading to the beach, the pool, just this weekend, going to be heading out and about? What's the best stuff to use?
Yes, what I always recommend to my patients is that they use something that's going to be at least an SPF of 30 with at least 5% or higher of zinc oxide. Look at the bottle, flip it over, look at the ingredients, look for zinc oxide. That's going to give you the best broad spectrum coverage, and it's also reef safe as well too.
What about moisturizers? We think summer and taking care of our skin, staying moisturized and hydrated. What kind of things do we look for in a good moisturizer?
Yes, very important to moisturize your skin, keeps that kind of hydrated, supple feel of the skin. Many different ones on the market. I usually recommend something that's going to be a little bit heavier for like a cream or an ointment for the knees or the elbows. Great ones on the market: Neutrogena, CeraVe, Aveeno. They make really good products. You may want to use something a little bit lighter for the face. Neutrogena Hydro Boost makes a great one for the face. Vanicream, they make a light moisturizer for the face as well too. And you may want to consider some of these more lighter ones for the body if you're more prone to acne.
Dr. Ann Truitt, dermatologist, joining us this morning with some good tips for all of us as we head into the summer months for taking care of our skin. Dr. Truitt, thanks.
You're very welcome. Thank you for having me.